Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter H. Today I'm going to talk about headaches. I think I had another video about headaches, just covered broad and general touch basis about the headaches. Today I'm going to talk about headaches stratified into age group. For the young people and for the older people, what are the major causes, particularly those serious, either serious causes or serious complications. I'm going to really focus on this dimensions, either age related and also the serious causes or serious complications. First of all, let's bring up the emergency situation. If headaches, regardless of age, if headaches associated with the first of all, the severity of headaches is very bad, the worst. If you're experiencing the worst headaches in your life, or the headaches associated with the fever, vomiting, and also exposure to some previous known diagnosed encephalitis or meningitis. These are, or the headaches associated with the neurological deficit, the drooling and or the extremities, either arm or legs lost the sensation or cannot move. So these are all the emergency signs, not just isolated headaches, but accompanied by the other serious problems. So these are the signs you need to visit the emergency, call your physician right away. So let's because I'm going to talk about those serious causes of the headaches or serious complications of the headaches. Of course, all of the headaches in this video is not in the realm of managing at home. You cannot manage any of these, the category, the headache in this video, you cannot manage at home. So I'm not going to talk about that. So let's stratify it into age group for the young people, from children to young adult. The most common cause of severe headaches or the severe complications by this headache are either the infections, either viral or bacteria. We all know that a Neisseria group of bacteria cause meningitis. This is very common, especially for the young adult. The signs, like I said, fever, and feel natural rigidity, vomiting, projectile vomiting, just shooting out, and feel very sick, and are sometimes associated with discoloration of the skin into the cyanosis or purplish. So that is the sign for meningitis. It's the really emergency situation. The other group of occurring in young or children is the encephalitis, usually caused by the virus, with no or unknown viral infection. For example, the upper respiratory tract infection a couple of days ago, and developed this altered mental status and also associated with the fever and headaches. That is, may or may not have the neurological deficit. Usually encephalitis, not like meningitis. Encephalitis because it's the inflammation of the brain parenchyma tissue, so that really sometimes, a lot of time, associated with the neurological deficit. So if that's the case, for young children or young adult, really need to call the physician or to go to the emergency. So this is the young group, the serious causes or the serious complications for the headaches. The other one is not quite common, but the consequences could be very severe, which is the headache associated with the brain tumor. It's not very common, but it could happen in the children, usually children actually, the young children. They have the genetic, some of the tumors from genetic causes may have this kind of presentation. The initial presentation is as a headache associated with, may or may not have a neurological deficit. It depends on the type of the tumor or the location of the tumor. So this is the young group. And for the older people, or for the middle-aged people with headaches, usually the serious causes I can think is probably sinusitis, infection, and also not exclude of the meningitis. Depends on the living condition, depends on the person whom is the patient that we're talking about, or the tumor. So this is the middle age. The older people, usually if the headaches, particularly when we talk about older people, always bring those comorbidities, the diabetes, the hypertension. If those kind of people or person developed sudden headache, the worst headache in your life, this is the typical presentation, typical symptom or signs for the subarachnoid hemorrhage, SAH. So this is the may or may not have neurological deficit. You suddenly develop this bursting headache, the worst, because this the hemorrhage located in the space really irritating the nerve endings, so cause very severe pain. This is one of the very serious condition need to see the emergency, and if this is the sign, do not move. Do not encourage patient to walk or to do anything, just carry them still to the call the 911. I think if the 911 is not available, or if the emergency situation is not available, have to carry it with the family steady, try to keep steady and carry to the emergency room. And the other, of course, 911 is the best. The other serious headaches associated with the older people, like the hypertension, really severe, sky high, might cause a severe headache. May or may not have the hemorrhage or stroke. But if that's the case, if you know you had high blood pressure disease, and even though you took medications, but sometimes life not as we predicted, you had under severe stress, then the blood pressure cannot bring down. So if that's the case, you really need to go to the emergency to get it chilled down, to bring the normal or lower the blood pressure gradually to prevent acute ischemic or hemorrhage. Or you have other problems like diabetes, hyperlipidemia. Those are all the comorbidities increase the risk of this headaches caused either by the hemorrhage or ischemic stroke. So basically, teasing off everything, I just summarize the most life-threatening headaches is the meningitis, encephalitis, or the strokes, either the hemorrhage or ischemic. May or may not have other comorbidities, but so these are the signs. I hope the group of conditions really life-threatening if not treated in time fashion. So just keep in mind all of those the worst conditions. So if, for example, if you, even though you're young, you had headache, start with not very bad, you thought it's okay, or if you're old, have that disease but have comorbidities, but you think, okay, I'll just take some Motrin, Tylenol for see whether I can do it, manage at home. But if not, then really take seriously, go to the emergency, call your physician to discuss, to avoid the serious complications. So this is about the video of the headaches that are associated with serious complications or severe causes. I'm going to stop here. Thank you for watching. I'll see you next time.